It's a simple fact. In an emergency, minutes, even seconds matter. And receiving medical care in a hurry is critical. Whether a patient is driven to the South Texas Health System Edinburg ER by a loved one or by ambulance, they will now have easier access to the facility's emergency department to receive quality, compassionate care. Relocated from its previous location at the back of the facility to the north side of the new tower at the intersection of Trenton and Sugar roads, the emergency department is now easily reachable from two of the city's main thoroughfares.
Ease of access is a huge deal for EMS, especially when it's coming to a closest facility for a very critical patient.
Clinical critical care manager Ben Dennard has worked at STHS Edinburg for 3 years. The Houston native who moved to the Valley to serve as a U.S. Coast Guardsman spent 6 years working as an emergency medical technician before joining South Texas Health System as a registered nurse. As a former EMT and during his 4 years with the healthcare system, Ben has witnessed firsthand the need for enhanced medical services across the region, especially during the COVID-19 pandemic. The new 5-story tower at STHS Edinburg is South Texas Health System's response to that need.
It is a huge improvement for our system in total, but a huge improvement for Edinburg.
Once inside, patients and their families will instantly notice an enhanced emergency department that's more than double the size of the hospital's original ER. Designed to help improve the overall patient experience, the new ER features a warm and welcoming waiting area, a private consultation area, and 4 triage rooms that will allow staff to evaluate patients in a timely manner.
So that we can get everybody in quickly and taken care of really quickly.
A level 4 trauma center, the new ER also features 2 large trauma bays, which are easily accessible from the ambulance entrance and can accommodate multiple patients at a time.
We try to keep these beds available for our very, very critical patients.
Meanwhile, the 14 spacious exam rooms feature dimmable room lights, overhead examination lights, multifunctional electric hospital beds with built-in weight scales to help staff deliver appropriate doses of prescribed medication, wall-mounted televisions, and windows in the majority of the rooms to bring in natural light, which research has shown to offer significant therapeutic benefits to patients and hospital employees alike.
I feel like a lot of ERs are really just designed for pure functionality and not really focusing on how the patient feels about the space that they're in. And so the natural light, the brightness of everything, certainly I think will play a part in bringing some level of happiness to our staff and our patients. It is very, very impressive. It is very beautiful. It is a huge upgrade for us. So gaining the greater bed capacity, the greater ability to take care of our community definitely brings our group here in the ER a lot of joy and a lot of pride.